Hey everybody, it's Sue from Get Fit with Sue and Easy Fit in 10, your online resource to help you get fit and stay fit, whether you're working at home or staying at home. All right, today's Fit Break is a tutorial, specifically a postural analysis and a little discussion about anterior pelvic tilt. What is it and how do we fix it? Okay, so first off, let's talk about what an anterior pelvic tilt is. It is when our pelvis is out of alignment. So our pelvis kind of is where everything attaches, our thigh bones and our spine, everything attaches down at the pelvis. And our pelvis, we ideally want it to be level. So we have these hip bones right in front, our anterior superior iliac spine, that's these guys right up here. And then backside, PSIS, posterior superior iliac spine, okay? So ideally, when we kind of wrap our hands around it, we want those two bones to be level with each other, okay? We don't want one to be lower or higher than the other, okay? So a neutral pelvic alignment, ASIS and PSIS are level. It's like a soup bowl. Okay, now, when we have an anterior pelvic tilt, those front hip bones, the ASIS, are tilted away. They're tilted down towards the floor, away from the center, okay? The PSIS are tilted up towards our shoulder blades, okay? Bam. And it's like we're a duck and we're walking around leading with our bellies. Not so great. We get ourselves into this situation a couple of different ways. Some of us are born with that posterior alignment. Some of us develop it over time by always locking out our knees and sticking our bellies out, okay? And many of us end up there because of our jobs, sitting at a desk all day. You might have heard the term dormant butt syndrome. Doesn't that sound fun? So, dormant butt syndrome is exactly what it sounds like. Your butt muscles, your glutes, have turned off. They're not doing their job. Because they're not doing their job, this can throw our pelvis out of alignment and cause that anterior pelvic tilt. Now, what's the big deal? Not a big deal, except for the fact that it often creates pain, or there's pain that's followed with it. The reason why, when we're in this posterior alignment, pressure of supporting our body goes right into those lower back muscles, specifically the QL, quadratus lumborum. There's going to be a test later. Kidding. Okay, so these lower back muscles get really tight, and it pulls on that pelvis, pulling the PSIS up and the ASIS down, away, okay? So that's one aspect. Overactive lower back muscles. Another aspect of an overactive muscle in this situation, a muscle that's working too hard, the hip flexors, also known as the psoas. There's a couple of them in there, and they get shortened and tight from sitting all day. So when we're sitting all the time, that muscle is constantly in flexion. It's all tightened up all the time. And it kind of gets stuck like that. That muscle wraps around. And so it kind of doesn't make sense that if that muscle is tight and short, how does that affect the pelvis? Well, it attaches up top there and it pulls that pelvis out of alignment. So with that tight lower back and tight hip flexor, that's tugging on that pelvis all the time and pulling those back hip muscles up, causing that lower back to tighten up even more. Okay, now, the flip side of this is that we have underactive muscles, specifically abdominals, and there's a specific part of our abdominals that are underactive, and then our glutes. Our glutes are underactive, hence dormant butt syndrome. Glutes not doing their job. They're dormant. Okay, let's talk about the abs first. Now, you might be thinking, hey, wait a second. I do my crunches. I do my ab work. What's the deal? Well, there's not just the rectus abdominis. The rectus abdominis is that outer abdominal muscle, the one that gives us that look of having a six-pack. Okay, maybe some of you have a six-pack. I do not. So, gives us that impression that we've got those rippled muscles, okay? That's your most outer layer. And those muscles, super important to have them strong because those do the work of flexing our spine, okay? But there's actually deeper muscles that are a little more important when it comes to posture. And specifically, the muscle we're thinking about is the transverse abdominis. This is the muscle that wraps around us like a corset, okay? And it hugs all of those organs in our spine in. And that's the muscle that's responsible for holding our spine in place. If that transverse abdominis is weak, underactive, or kind of turned off, we don't have any support for our spines, and then we're just kind of all noodly all the time. So we strengthen that inner abdominal muscle with actually isometric exercises like the plank and things where we're holding, drawing the abdominal muscles in. It's actually not a lot of movement. Okay, so we strengthen transverse abdominis, and we also make sure that we want to be paying attention to strengthening the lower abdominals. One of the things that can happen when our hip flexors get really, really tight, they're compensating for the lower abs not working. Women who've had abdominal surgery or cesarean sections or a hysterectomy, often you get a nice little smile line right across those lower abs. And in order to get that baby out, they have to cut that muscle. So you're in a situation where your upper and lower muscles are separate. And so you do need to focus on different exercises. If you've never had abdominal surgery and those muscles are still connected, when you work the upper abs, the lower abs will fire. However, there are specific exercises that we do that target the lower abdominals. And I'm gonna get to that in just a sec. All right, so back to what we want to activate. So when it comes to fixing our anterior pelvic tilt, we want to activate the deeper supporting abdominal muscles, our transverse abdominis, and then specifically try and start getting those lower abdominals to wake up and do their job. In Pilates, we talk a lot about the pelvic floor, and these are the muscles we're trying to target. It's the muscles that go from your pelvic bone back, and they act like a hammock. We want to be able to pull up on that hammock and draw those muscles up. That's coming up in a sec. All right, so the deep inner abdominal muscles, those need to activate. And then when it comes to our backside, we need to activate all three glute muscles. Gluteus maximus, that's the most outer, gluteus medius, and gluteus minimus. All of those muscles need to be active and need to do their job. Those muscles are hip extensors. They move that leg back and away. So we need to be able to get those muscles to activate without activating the lower back and the hip flexor. That's the big trick. So when we're working on developing a program to help us release and fix our anterior pelvic tilt, this is how we do it. We activate those deep abdominal muscles without activating the overactive muscles. Same thing with the glutes. We activate the glutes, but without activating those overactives. And in my next video, I'm going to take you through a program that does just that.